How to check your blood pressure at home. Preparing to take your blood pressure. Avoid smoking, eating, drinking beverages with caffeine, alcohol consumption, or physical activity 30 minutes prior to taking your reading. Remove any tight clothing or jewelry that may interfere with cuff placement. Blood pressure readings will still be accurate if measured with a thin sleeve under the cuff. Thicker clothes should be removed. Keep the monitor stable during measurement. Movement, vibrations, or other activity will interfere with the reading and may cause an error or inaccurate reading. Check your blood pressure in a quiet place. You should be seated with both feet on the floor and relaxed for at least 5 minutes before checking your blood pressure. Remain still and do not talk while the machine is reading your blood pressure. Applying your blood pressure cuff. Insert your left arm into the cuff, with the bottom of the cuff edge 1/2 inch above the elbow. Position the cuff so the air tube is running in the center of your arm towards your fingertips. The cuff should fit comfortably, yet snugly, around your arm. If you are unable to use your left arm, you can apply the cuff to your right arm and modify the instructions for right arm use. Use the same arm each time you check your blood pressure. Position your arm. You should be seated in a relaxed position with your lower arm resting on the table. The cuff on your arm should be the same level as your heart. Relax your hand. Do not stiffen your arm straight out, drum your fingers on the table, or doodle with your hand. This may cause the monitor to read your blood pressure higher. Measuring your blood pressure. Press the start-stop button to turn the unit on. The cuff will automatically begin to fill with air. The cuff will automatically let the air out and your readings will appear on the screen. Press the start-stop button to turn the power off. Wait 2 to 3 minutes before checking another blood pressure measurement. Waiting allows the arteries to return to their condition prior to a measurement. When and how often do I check? If you have just started a new medication or a new dosage, check several times a day for several days to see if your blood pressure is in control all day long. Check at least morning, noon, and bedtime in the beginning. If your blood pressure is stable all day long on your current dose of medication, check daily during the times your blood pressure tends to be the highest. Continue to check at least 3 times a week to be sure your blood pressure stays in good control. Check right before you take your blood pressure medicines. Using the results. Call your provider's nurse if your blood pressures are going up steadily over a week or longer. Bring your blood pressure log to your follow-up clinic visits. If your blood pressure is 180 or higher on top or 100 or higher on the bottom, rest quietly for 10 minutes and check it again. If it remains high, call your primary care provider or go to the nearest emergency room. Goal for your blood pressure. The goal for your blood pressure is less than 130 for the top number, systolic, and less than 80 for the bottom number, dystolic, unless your primary care provider has given you a different target.